Hey friends, Dr. Christy here, and today I wanted to come to you with a real life example of why it's so important to get a big picture assessment when doing blood work. So I've done this topic before in my previous thyroid video. You can go ahead and check that, but I just want to show you in real time, in real life, what this could look like and how it could actually be damaging for a patient if you don't get the full picture. So here you go. This is a real life thyroid panel that I run on a patient recently. Okay, her TSH is elevated. Ideally speaking, for someone in this woman's age group, she should have a TSH between 1 and 2, in my opinion. Now remember, TSH is a pituitary marker. Pituitary is the gland that tells your thyroid to make thyroid hormone. So this is basically telling her thyroid, make more thyroid hormone, make more thyroid hormone, because it's elevated. If this were too low, then that would indicate that she'd have some kind of hyperthyroid situation going on. Based on this number alone, it would suggest that she has hypothyroidism. However, her thyroid function is totally, completely perfect. These values are not only in the reference range, but in my opinion, they're optimal. So why is her TSH elevated if the rest of her thyroid is doing its job? This is why. This person has an elevated cortisol level, not high enough to be a really big problem necessarily, but enough that it's impacting how her brain is interpreting what's going on and if it needs more thyroid hormone. Her DHEA is also elevated. That's another precursor to all the sex hormones. Her body's essentially starving for the right kinds of hormones, so it's doing whatever it can to upregulate the function and upregulate the production of these different hormones just so she can get what she needs. So if she had gone to a regular Western medical doctor where they didn't do the rest of those hormones and they just did TSH, based on her level of TSH alone, they would likely have given her Synthroid or some kind of thyroid medication, which would have synthetically increased her thyroid hormones, potentially putting her into a thyroid storm, which can be incredibly damaging and harmful to the person, completely ignoring the root cause for why her body was doing that in the first place. So, real life example, real life lesson of why it's always important to go deeper, especially with the hormones, finding the root cause. For this individual, it's simple-ish. There's more to it in the pages of the lab work that I didn't show you, and there's more to it in the interactions and what the story is of that individual human and what's going on in her life. But essentially what we're talking about is her body is stressed. Maybe that's coming from liver, maybe that's coming from blood sugar, maybe that's coming from yeast or parasite or something that her body's fighting, right? Either way, her body is stressed and her system is responding to that stress by telling her thyroid, hey, we need more, when it may not actually need more thyroid hormone. It might need something completely different. So don't guess, test, make sure that you're doing your due diligence on really getting as many details as you can as possible when doing blood work with your doctor so you can understand what's really happening in your body and how to fully fix it. Got questions? Drop them below, and I hope you have a good rest of your day.